teachers meet children where they are, but we have to meet families even sooner than kindergarten and early childhood.
This community center approach to the schools is it's a wonderful example of sort of the community rallying around where we're have shortfalls, right? But the burden is becoming heavier and heavier on schools until our other community policies can catch up exactly. And unfortunately, sort of the compensation and recognition of that is not at the level of what the schools are having to do. And so there's a huge policy opportunity there, I think, to outfit schools appropriately the way we need to be able to kind of pick up the slack.
This topic of childhood social, emotional, mental health, well-being definitely has been a topic that we've heard throughout our travels throughout the state. And just by a show of hands, is that a major issue in this community that we need to address? Okay, good. So I think it's in some sense a good comfort, if you right, that's the right word to know, that we don't live in our bubbles, that the issues that we're seeing here in El Paso County, we also see on the western slope, we also see in the San Luis Valley. And our children's campaign staff has done a great job of traveling the state and hearing those quantitative and qualitative data, collecting that to find out what are these emerging issues. And definitely childhood and adolescent behavioral health has really been a top topic over this last year. So thank you, and it's glad to see that's true here as well. I guess I would like to just touch on a few other successes that we're seeing in our communities. Does anyone have any good examples or a good story of something that's been going well in their particular area? Kathy, go ahead, sir. Oh, Colleen, go ahead. Put my Oh, you were just pointing over her head. I saw.
So one of the, I think, successes that we have experienced recently is a nice example of a community collaboration that really puts effort into successes for families. And that's a recent training that we have started to provide called Positive Solutions for Families. And it's a curriculum that is supported by Pyramid Plus. And it is a 6-week session for families to come and learn about supporting positive social emotional development, effective parenting, and then managing challenging behaviors when they come in a positive way. And the success with this is not the curriculum itself. It is actually the community collaboration that is creating an environment where we get 20 to 40 parents attending every time we set up a 6-week session, and they're sticking through all 6 weeks. And that is a remarkable thing to see. In my 30 years, this is the first time I've seen that level of commitment on the part of the parents who are attending. And I believe that it's being successful because we have partnered with several churches in town, and they have created this safe environment and a trusting environment for these parents to come. When they get there, there are a bunch of parents just like them who they begin to form friendships with, and we know that those social connections are really important to parents, and many of our parents are often isolated, particularly when they're dealing with challenging situations, both for their family and for their child. And then third, we meet some of the basic needs that they have when they come to these trainings. We feed them dinner, we provide childcare for them so that they don't have to worry about what that's going to be for their child. We provide snacks and food for the child as well. And they continually ask us, can we keep meeting together after this is finished? And I think it's a good example of the breadth that we need to consider when we're thinking about what families are telling us they want and they need.
One of my parents actually went to the positive parenting classes, and she said she loved it. And it helped her because she had a set of twins, and one of her twins was a little bit more sensitive than the other and a little bit more emotional. And so that helped her really work with him. So she really appreciated it, and she wanted to say thank you.
Any other successes we'd like to touch on in the community? Okay. So a lot of what we've been talking about today kind of comes through this lens of a two-generation approach. And who's familiar with the two-gen kind of lens looking through? Most of us are. Good. So that's really looking when we're providing services that we're not just isolating just the parent or just the child, that we're really thinking about a holistic approach to help both the mom and dad and the child or the grandparent, whatever that household looks like, achieve self-sufficiency, achieve economic security. So I'd like to maybe, if you could, get a little more in the weeds here, talk about maybe more of a two-generation lens and some good programs that you see in your community that really focus in on that Kathy leaning in. So, yes, please.
So what's really interesting is that's everybody's talking to Jen, everybody's talking trauma informed, everybody's talking systems building, and I think we're actually getting there. We recently wrote the child abuse neglect framework for El Paso County to prevent child abuse, and it talked a lot about communities and education of parents and children, and it's all supported in the data that says you can't treat a child in isolation, because if we're talking about adverse experiences in childhood, and we talk about one of them could be the parent has depression or mental illness, what good is it to treat a child if we're not treating the parent, right? And if parents are raising their children the way that they were raised, they don't have a lot of the skills that they may or may not need to help their child, so therefore you have to do the two-gen approach. The other thing is we recently looked at a grant that was around child abuse and neglect prevention, so we were looking at how to write this, and we wrote it as a two-gen approach and working with staff. We have another project that we recently were just looking at, and it is a two-generational approach. And once again, it's a lot about systems. How do we get all of our systems to work together? Because not everybody comes in the same door, not everybody has the kid the same age, and not everybody needs the same thing. And I think a lot of times we think that everybody needs mental health services, and they don't a lot of times. What they need is social support. Some people do need mental health, and sometimes we do need to have those folks involved. But sometimes it's just about getting down to the community level and supporting families so they can become successful. If you can take off the stress of having to buy food for your family, then maybe you can enjoy your dinner a little bit better when you sit down to have dinner with your children. So 2GEN is huge. We're working a lot on it right now in El Paso County, and for the first time in my life, we're almost there. I refuse to be pessimistic, but there are days when I get these phone calls from people who are in systems and they're not working and they're upset and the kids are in chaos and DHS is involved and everything is bad. Let's get to people before they're in crisis. Let's support them where they're at so they can be successful and we don't have to put them in the systems.
And we'll touch on two-gen approaches. I guess, Christina, I'm put you on the spot again, I'm sorry, because I come from the human services world. I think about this through child care and early intervention. I'm fairly new to the K-12 space. So I'd like to maybe just touch on, if you guys talk about community building, but how are you looking at it in Harrison School District for two-gen?
What we see is the 3-gen approach, even more than the 2-gen approach. So we're looking at children, parents, and oftentimes grandparents or extended family. Many of our children are navigating and moving back and forth between parents and or grandparents. We have a number of families because of the lack of affordable housing in the community, not attainable, we need affordable housing. Our families are living together, multi-generational, and if, mom and dad are trying to get out the door early in the morning, we're often dealing with grandparents or aunts and uncles. So we invite them in. We use a program in our district called the VIP program. It's the very involved parent, although it may be the very involved grandparents or the very involved aunt or uncle. And that's become critical. We really have to see the child's whole community when they come to the school and embrace them. I was in a kindergarten classroom last week, and it was phenomenal. The teacher said, okay, we're working on sight words at the beginning of the year, but I've invited all the parents and grandparents in every morning because they often don't know sight words. We're learning to spell together. We're learning vocabulary. We're learning academic language, all of us together. So I think meeting those families where they are and making that a community space, which is not always easy for K-12 education, and not every teacher is open to it, but we're working really hard in our district to make that an appropriate thing and to meet families where they are. And I hear you all talking about, we talk a lot in K-12 about personalized learning. There's personalized learning for families and meeting personal needs. Every family is different. It's not one size fits all. But I think our community is coming to do that.
Anything to add to this? Sandra, please.
So luckily in family childcare, the 2-gen approach has been going on for decades because the entire family is always involved. So we have a leg up on that one, so I'm really excited. But you're right, it is important to involve the entire family of the child. It's a family, it's an involvement, everybody, it's all inclusive. That's what family childcare is about, it's all inclusive. So if we as family taco providers are having a picnic, it's not just the child and the parent. Usually the grandparents come too. It's just, that's the great thing about having, that's what I love about being in family childcare, because our relationships with the families is usually close. You know, we really know these children very intimately, because there is no turnover. We don't have to worry about paying a staff member, you know, because we are the staff member. We have many hats, which is beneficial a lot of times. You don't have to worry about saying, okay, these rules, you need to make sure you do these rules and regulations the same, or this way or that way, because we do it all. So that's, don't have any challenges with the 2-gen or 3-gen approach.
I would agree. I'm in the center setting, and we see grandparents, uncles, aunts, moms bringing in children. We see grandparents raising children where families have stepped away. And so I would agree that it is very important that we continue the 2 or 3-gen approach, because it takes a village to get us through this.
Yeah, great segue. I was going to say, as a new parent, I know more than ever that it does really take a village to raise a child, and it's more than just the immediate family. It's you know, all those interactions around you, and it's less of a program and more of an environmental issue. But we've sort of lost that village setup in our neighborhoods and our communities, and particularly with the affordable housing crisis, there's so much transience and people have to move even to a different apartment complex, right? But that lack of permanence really destroys that village model, and that becomes a major issue at all generations, right? And so there are some things we can do at neighborhood levels, and you know, addressing the housing crisis so that there can be some permanence, and you know, you have healthy food, and you have neighbors that you know and can rely on that can help.
I fully agree, and that's exactly where I was going to. I think that the idea that the community needs to be the central place where we learn what these children and these families want and need. And that in order for a 2-gen or 3-gen or community-based approach to be successful, it needs to be driven by those family voices and those community voices. I think historically as programs, we've done really good jobs delivering programs to and for parents, and we haven't done such a good job doing it with them. And that really has to change in order for us to be successful, because this is really complex change we're talking about, and complex needs for these children and families, and it takes all of us as partners to do that, but that means families need to drive it. We can't be in the driver's seat anymore. That's a really hard shift in perspective for most of us who've been doing this.
I'm going to shine the spotlight on the audience. Does anyone have a good example from you all of a good 2-gen approach that you've seen that's been successful in your community? There has to be at least one out there. Yes, Jackie, please.
I don't see Doreen. Where's Linda? Linda, speak up.
Kept thinking if Noreen was here, this wouldn't be a big deal. I wouldn't have to stand up.
There you go.
And we'll see what Noreen is. I'm Linda Meredith, and I'm with Community Partnership to talk about under CPCD, Asian Children and Head Start. Head Start has a more than 50-year history of being a 2-gen program. It started out as a summer nutrition program, and parents have always been a central part of it. We currently have a 2-gen program that's in partnership with Pikes Peak Workforce Center and with Pikes Peak Community College. And we are offering parents who have children enrolled in our program training in different fields. Currently, we are training them for child development, so when they are being hired by us in other early childhood programs in an entry-level position, and we employ them as interns while they're going through the program. We have parents that are in IT training, and we currently have just employed one who graduated from the program with an A+ certification, whatever that is. And we all, I don't know, I appreciate it, but I don't know what it is. And we also have a partnership in where we're offering training in welding to parents. We have an opportunity for manufacturing if parents are interested in that. And so what we're trying to do is we realize that we can get parents to break the cycle of poverty, that, you know, we can get them employed and those kinds of things. So we can break the cycle of poverty
poverty in one generation to the other. But as a classic example, Head Start assumes an income generation from the very, very beginning of 1965. And we have partnerships with pretty much everybody in this room. And I think that that's made a huge difference for this community, that we have parents that are engaged at all levels.
Great, thank you. Thank you for standing up, being on the spot. You give her a hand. So we talked about some successes, and like I said, we're in the midst of elections. We got to start talking about what does the next legislature do? What does the next governor do? What are they working on? So I want us to get into the weeds a little bit and talk about a specific policy area, a specific policy lever that you believe needs to be addressed, and how would we address that moving forward, let's say in the 2019 legislative session. Would anyone like to talk about what specific issue they need to see changed? Go ahead.
Family-friendly workplace policy, so longer leave times and free time to be.
And if you find just expanding on importance and, sorry, for me to make you gloss over it, but if you wouldn't mind, why is that important? I'm sure we can connect the dots, but I'd like to hear from your perspective.
Sure. Yeah, I mean, we know that this, challenges and opportunities start in the womb and even before that with the generation before us, right? But those first few months are so critical in starting off right. And when we're talking about risk and protective factors, family interaction, parent efficacy, things like that, those are hugely important. And if you're only thinking about how quickly you need to get back to work, you know, to just put food on the table for your family, that goes out the window. So,
Thank you very much. Colleen?
But there's a website called zeroweeks.com or .org that actually speaks to that very issue and really helps you understand the impact and how far behind the United States is in the rest of the world in providing paid leave. Not just for maternity leave, but for elderly care, for a sick person in your family, and the impact that has on a family's ability to be successful. I think for me, the other big policy issue is this idea of allowing broader collaboration across funding streams. Our programs are so funding stream driven and they're so siloed that it really sets up a lot of barriers for us to be successful. We have an incredibly creative community and collaborative community, and yet those things are still really hard hurdles for us to get over and how we're going to meet an entire family's choices and needs.
I'm going to echo what Kelly just said. We need to really look at a hard shift in just funding policy programs. How many of our programs are really effective? A lot of our data is way back on old data when these programs were first set up. These programs are not nimble. They have to change to meet our people's needs. The biggest one of the challenges I haven't heard anybody talk about is childcare. How many of our parents work 8 to 5? How many of them don't? And then there is no childcare. I was a nurse. I worked second and third shifts, and I did weekends and holidays. You know how hard it is to find childcare for them? There is no such thing. Our transportation, is the transportation a problem that we don't have any, or is it running at the wrong times, right? Because if you work in a second or third shift, how many buses are there to have? So I think a lot of it is that you have to start looking at, we have great systems, but they have not changed or kept up with the needs of what our families need. And why do they have to go to 6 different offices and keep filling out application after application when they have to take time off when they're not paid, right? It doesn't make any sense. Can we do one central sort of application? Maybe we could actually sit down and ask people what they want, right? Okay, we have maybe so many dollars, you can use it how you want to. Maybe it helps them learn how to manage maybe a little, gives them some choice, gives them some voice. I just think that we sometimes try to tell everybody what they need to do, and it doesn't happen.
From the family childcare perspective, like I said, shortage of infant spaces. There was just a new bill passed in 2017, Senate Bill 17-110, accessibility to childcare. This particular bill is a great bill. It increases the slots for children. However, I think there need to be some safety measures because none of these unlicensed providers have to have a background check. None. And they can watch 4 kids. Or a lot of family childcare providers can only watch 6 children. They're licensed. We have to have at least 15 hours of continuous education every year to watch 6 children plus 2 school-age children. Unlicensed providers have to do none of that and get to watch 4 children, 2 of which can be under 2. I don't have a problem with unlicensed providers. What I have a problem with is the safety of the children. Because nobody's overseeing these unlicensed providers. Nobody knows what this unlicensed provider's real name truly is. I understand you can do your background checks, but can you pay $50 for every person you want a background check? For every adult in the household? You can't. That should be changed in the new regulation. When this bill comes into sunset in 2020, please revisit it. Please look at this and say, if you're going to be an unlicensed provider, you must apply to be legally exempt. You must have a background check for everyone in the household 18 years of age or older, so we can ensure that these children are not submitted to sexual predators. You know, they're not put in danger like that. I'm not saying that unlicensed providers are worse. I'm not saying that licensed providers are better. But at least let's be proactive to make sure that these children don't possibly go into a dangerous situation, like a $20,000, $35,000 drug bust. You know, that could have been prevented. And maybe increase our ratio. Let us have a few more children so we can fulfill the need that we want to fulfill. But we can't. We are just tied down, and this is not just us, family childcare providers, it's centers. The schools have the same ratios. They have to adhere to ratios, you know, so I can have 6 children in Fountain because city code zoning supersedes state zoning. So even though the state says I can have 6 plus 2, Fountain says no, you can only have 6. So there's a discrepancy between the zoning regulations. Yes, you can be licensed, but you can only have 6. Yes, you can be licensed, but you can have 9. Oh, we don't care how many kids you have. You know, as long as you give us $100. There needs to be something. You know, there needs to be something across the board. It needs to be parallel across, because you cannot ensure the safety of children if the regulations are so different across the different cities. Just 1 mile apart. If you're unincorporated, the regulations are completely different than if you're within city limits. You know, that there needs to be, it needs to be more even, and making sure that everything is, I don't know, I'm just battling out there. I just want to, specifically the unlicensed providers, and obviously, like I said, more social emotional, maybe do that, and yeah.
Building up that, Jack, I put you on the spot. Maybe talk about something, a policy, some funding that you would like to see more at the state level that would help really this community and help the efforts you're undergoing.
I would like to see more funding for our workforce. I would like to see more funding for capacity, for building more centers. We need dollars for the workforce, we need dollars for the children themselves. I think we need more funding. I can't say it any clearer. We need more.
Touching on that workforce, there's actually a legislative interim committee that we're involved in, the Children's Campaign is involved in. They're the Early Childhood School Readiness Legislative Commission. It's a mouthful. But one of the bills that they are exploring and we'll be voting on October 2nd is a tax credit for early childhood educators. And really talking about how can we incentivize early childhood educators to get into the workforce, how can we incentivize college kids and those in universities to actually want to enter into this, but how can we make sure that you are being reimbursed at an appropriate rate for the educational attainment that you've obviously worked very hard for to get to. So we're exploring those different levers on what we can do with the Department of Revenue, Human Services, Department of Education. How can we incentivize this critical workforce where we do see a shortage? We don't have enough workers, and they're certainly not being paid enough. And I know Sarah Hughes has a graph that just ticked me off the first time you guys saw it, that she's been in touch on with you guys today as well. And I know I'm going to always come back to Christina on the spot, talk about K-12. What is a issue that you would like to see addressed, a policy lever you want to see pulled moving forward?
Good grief, could Colorado just get to the top of education funding and not be, near the bottom. We've got this great state, and it's embarrassing when you look at education funding. So we've got to improve that. Amendment 73 is something that you'll hear lots of K-12 school districts talking about. It's highly important. And it's great for our K-12 educators. Most school districts, should it pass, would use that to actually pay their staff, to increase salaries. They can use it for other types of improvements in school districts and directly for children. That doesn't solve our early childhood provider crisis, and I'm really partial to that too, because that's where I grew up. But I think it's so critical that we talk to our representatives, and we get out there and we talk about the importance. It won't matter what our workforce looks like if we don't take care of our children first. So that's huge. Many school districts will have measures and have had measures on the ballot. It's a long ballot this year. I know we have 4E, which is a bond initiative on our ballot. It's a $180 million bond in Harrison School District 2. We have not passed a bond since 2001, so we are behind the game compared to our neighboring districts who have passed them more recently and had mill levy overrides. But many of our districts are just trying to keep up with infrastructure after the negative factor, and since 2008, our district alone has foregone $90 million in funding. Had we had that $90 million, we would have kept up with a lot of our facilities. We would have done a lot for our kids with technology, with security infrastructure that we aren't able to do. And we've done a great job managing our dollars and being fiscally responsible in our district, but we're not where we want to be for our children or for our parents or our staff. So our community in general will see 4E on the ballot come November. But I think that's huge. We have to understand and invest in education.
Any other prevalent issues that someone would like to touch on, or, yeah, Sandra, please.
As far as funding, one of the things that I've noticed for family child care providers is that the funding tends to come more to those family child care providers who accept CCAP. So a lot of grants are dependent upon, you cannot a lot of times qualify for a capital improvement grant unless you have a CCAP contract. And how do you expect quality childcare across the entire state when you limit it to only those who have a contract with the state? You know, we are talking about Colorado Shines. You want to improve all these ratings. You want to make sure that we have quality family childcare, but funding is a lot of times limited to those who receive the state benefit. And it's not fair to the private sector because they have the same struggles, just like all the ones that are accepting CCAP. So give everybody the same opportunity to improve their program, not just those who are choosing to have a contract with the state.
Kathy, did you have something you want to touch on?
I would just like to point out, when we're talking about systems, when funding comes through, we have to take a look at and understand how many different school districts there are in El Paso County. And this just really creates a really hard problem for a lot of our school districts because everybody has to apply for their own funding, and if you're in a certain neighborhood, you're more likely to get a bond. It sure would be nice if there was some way as a community, I don't know if we have to change the district funds or anything, but could we get funding for a community and put it based on where the need is? Because I think that's a problem, just like you said, we always apply for grants, grants are really specific, and they only pay for certain things. And then we always look at, you know, who demographically needs this or that or the other thing. One thing is the idea, if we change the system, put a lot of money out there and put it where it needs to be, right? Because then we're all having grants, and we're all paying for administration of those grants, and how much money of the grant are we wasting? Because we have to have 14 different grants to support 14 different school districts. Could we have one big one and just take care of everybody? Once again, we need to change how the systems are set up.
Here on that. Just a reminder that food access, housing, transportation are all early childhood policies. And, it's difficult as agencies, we're, clawing day to day just to meet the immediate needs, but if there's any breathing room to come up and advocate for those higher levels, especially when we're talking to Jen, right, that those are issues that trickle down and are high upstream that that maybe could resolve a lot of the burden on various agencies.
I think also that we tend to fund and regulate being driven by personal accountability, that if we, as for your example, if we give dollars to those sites who are starting to reach these different quality levels, then we're kind of motivating a movement towards quality, but we don't fund it at a level to truly motivate towards quality. We have, what percentage of children in unlicensed care? And that's a 50% population that we're ignoring essentially by saying we don't want to put dollars there because we don't want to motivate unlicensed care. Well, guess what? It's happening. And if we're ignoring it, then that's 50% of our children who are not getting any attention based on all of these things we just talked about. And we have to let go of that personal accountability piece and understand what Kathy's been talking about with trauma and adverse experiences and how that affects people. And we have to step back and say, where did we start and how do we help all of them, not just the ones who are doing life the way we think they should be.
So we've touched on a lot of issues here today: early childhood prevention, intervention, K-12, and we are in an election, like I said. We have some critical things on our ballot, whether it's a new governor, whether it's some elected officials at our state legislature, House representatives, or Senate. And we've talked on these issues, we've said the challenges, but I want each of you to real quick think about if you could have your elevator speech to a candidate. If you could tell someone here running for office right now, what is one issue they need to talk about more, what would that issue be? I'll let anyone jump in. Sandra, looks like you have something on the tip of your tongue.
Free childcare for every child in Colorado. It's not free. Nothing is free. Imagine free childcare for every child in Colorado. It's wonderful, isn't it? It sounds great. You don't have to worry about it. Hey, my child is going to free childcare, but a lot of other people would be affected by that. It will affect the economy. It will affect centers. It will affect family child care providers. It will affect the children. Imagine your 6-week-old child going to a public school system, free child care, because that's where all the funding will go. Are you, as a private center, would you want to provide free child care with the CCAP rates? Let's say that's basically what will probably happen. Are you willing to take in 100 CCAP children? And can you pay your staff with that money? It's not possible. Let's be more realistic. If you want to have free child care, I can't see it happening. So just instead, make sure that you have available child care. Help the child care providers that are in business increase their ratio. Let them take a couple more children. Even if it's just 2 more children, that can make a huge difference. Even if you increase the number of infants they can take, that would make a huge difference. Ask and give people who take care of children an incentive to become licensed, to become accountable, to be rule followers, not to hide the children in a closet in case somebody shows up, but be able to have them there openly, not do it illegally, because most unlicensed providers still watch 5 or 6 children even though they can only watch 4. Trying to get a new generation of child care providers into our states. So maybe that's where some of the money should go.
Christine, what about you? If you were to talk to a candidate right now and say, I need you to focus on one thing, what would it be?
So I'd have to say education funding. Okay. I'd have to say, please get Colorado up in that top tier. Focus that way. We can solve a lot of the equity issues, and we can take care of many, many employees in our state if we would focus on education.
Jackie, is there something you wanted to say?
I think my main topic would be funding, resources, and additional support for our early childhood workforce.
Colleen or Kathy?
I know I sound like a broken record, but we have to stop funding the way we fund. We say everything has to be evidence-based, so we get stuck in those models. Can you fund us to fail, maybe? To maybe find a different way? I'm serious. There's a really big, lot of talk, especially coming out of Harvard. And they talk about how all we say is if we work with these group of people, then they succeed, and we all feel good, and we keep putting our money there. We never look at those 50% of people who don't show up at child care. We don't look at people who fail out of the systems. Why can't we do that? Why can't we go to communities and let them decide what they need, right? Start having that family voice. And if we start building communities, maybe what we won't have to have as many interventionists going into the preschools to start working with these kids. Let's give some of the control back to these communities. Let them decide. But I think we're so stuck in evidence-based programming that we don't consider any other options. And I think it's important to start thinking about that. We really need to change our perspectives.
Aubrey, do you have something to add? Get a mic in your hand.
Sure. Yeah. We talk a lot about the what, but I think we need to spend a fair amount of time, equal amount of time on the why. And, one of the most impactful things that we talk about from a data perspective is the discrepancy in life expectancy. That it really hits home for people. And depending on if I'm born in a neighborhood 5 miles away from your neighborhood, it's the difference between 64 years life expectancy and 82 years life expectancy. That's a big deal. And that plays into a lot of factors, but it gives us a frame of reference for why we're doing this and why this is important.
We're kind of getting close to the end of our time here, so I wanted to thank all of our panelists for being here this morning, waking up this early to talk about kids' issues. We give them another round of applause. I've only been in this position for a month now, but I did work for the Department of Human Services before this, and a lot of these issues that we're hearing throughout the state. And so I want you to know that we're going to touch on them in our Kids Count presentation, so that the Children's Campaign is going to be fighting for these issues down at the state capitol. Whether it's catching kids earlier on more of a prevention track instead of intervention, whether it's CCAP funding.